Good evening, everyone. A warm welcome to this free session of neurotherapy. And here we can see Acharyaji's Guruji, Lajpat Rai Mehra, founder of and pioneer of LMNT. Okay. So he is the Guruji of Ramachandran sir, Acharyaji Ramachandran sir. And he has been learning directly from the first batch of Lajpat Rai Mehra sir. So he is the first batch and he has gone to various countries to teach this neurotherapy. And this is Lajpat Rai Neurotherapy, it is named as. And it can treat all the issues of our health from the root cause. So I request everyone to please be attentive in this session and note down everything that you are hearing, listening, and seeing so that you can collaborate it with your notes, and later you can practice the same whatever you have noted down. So we always inform you to please keep a pen and paper with you so that you can note down what sir is saying and you can collaborate it with this session later when the recordings would be released later. Okay. So all our hearts, let us give a warm welcome to Ramachandran sir. Good evening, sir. Warm welcome to you to this session. To this session, actually, there are two topics which sir will discuss today, and many other topics too, depending upon the time. Okay, so let us not waste more time. A warm welcome to you, sir. Good evening, sir. Please take over the session. Thank you.
Thank you. Yes. A very warm welcome to all the members of Joshys Kerala Group. Grateful thanks to Joshi sir, Anusha madam, and each and every one of you for attending this session. I hope to give some practical tips for certain burning issues. And I am sure all of you will benefit by it. Already you have seen, some of you must have seen the feedbacks from the diabetics challenge group that many people have got benefited. I shall be soon posting the statistics also. Really very encouraging that many people who are having even diabetes for 20 years, 18 years, 10 years, 12 years, even they have got benefited a lot in many ways, not only in sugar, but also in many other related issues. So we just go down to the mentor, Dr. Lajpat Rai Mehra, founder, pioneer of LMNT, and we seek his blessings and we go ahead. Okay, so now these are some of the pressing questions which always are in our minds. Some people, because today's topic, as you all know, is about body temperature, feeling cold all the time. Basically, this is it. And then we will be also touching about anemia. So these are the two topics. Feeling cold all the time. I know it is not so for everybody, but it is a really an issue for some people. And anemia is an issue for many people. So that is why I have selected these two topics, and I'm sure you will all enjoy it. So some people, they feel cold all the time, even when the central heating is on. Do your hands and feet constantly feel like blocks of ice? You know, you feel so cold that the hands and feet are very cold. And do you get frustrated sitting there shivering away while your partner complains how hot they are feeling? In today's lecture, we will be examining in great detail the answers to the following questions. So what are the questions? Why do I feel cold for no reason? Quite often we do not know the reason why we are feeling cold. Then should I be worried if I am always cold? Why am I so cold and tired? And why am I cold but not sick? So sometimes you feel so cold, you say, nothing, I don't have a fever, I'm not sick, still I'm having all these things. So why is it? So first, let us see, feeling cold all the time, let us see what are the symptoms. Main symptoms are, when you are feeling cold, your body might show symptoms such as pain, numbness, stiffness, joints become stiff. So naturally, pain will be there also along with it. Then there may be swelling in certain places. You feel discomfort. Then you feel tingling sensation. Sometimes you may shiver so much that you feel chills. You will have weakness. You can have skin color changes. So when you have all these symptoms, what does it mean? It would mean that your body can't handle the cold you are feeling. So there are many reasons why you may feel cold. And here I am only listing some of the important ones. There may be other reasons also, for which if anybody has any other reason also, we can discuss it later on. Okay. So there may be many reasons. The most important of them is anemia, then hypothyroidism, then blood vessel problems. It is called peripheral artery disease. Then you feel cold after a workout or exercise. Then sometimes you have to skip meals and then you feel cold. Of course, diabetes is a major issue where you feel cold unless without any reason. Then anorexia. Then low body mass index, BMI means body mass index. It's always related with low body weight. Then low blood pressure. Then vitamin B12 deficiency. Then gender, that is, ladies often have this problem more than men. And pregnancy. Then there is a phenomenon called Raynaud's phenomenon and cold intolerance. And finally, anxiety or panic attacks. So many of these, I will be giving some simple solutions. Those who have been attending my earlier classes, for them, the solutions may be known. For other people, we will explain. So now, and most importantly, not getting enough sleep. So now, let us see how body temperature is controlled. So I have written this out so that those of you who want can follow the written matter. You can zoom in your mobile. You have the facility of zooming. Sometimes it is easy to see and listen. Otherwise, you can just listen, whatever. So maintaining a suitable body temperature is critical to humans, very critical. Why? Because the various chemical reactions that our body relies upon. Our body relies upon so many chemical reactions, and they operate best only when kept warm. And up to 40% of the calories we consume are burned by the body as fuel to keep us warm. So that is the reason 40% of the calories, whatever food we eat, 40% is burned up by the body as fuel. So if this burning up is done properly, then only it will keep us warm. That is what you should understand. Okay, a range of different processes operate to help keep our body temperature within reasonable boundaries. It's always a scale. It is not, our body temperature is not always a fixed one. Okay, it depends on the external environment, the temperature, on the weather, etc. And this process is known to scientists. It is called thermoregulation. So at its simplest way, we can think of two different systems. Firstly, how much heat we produce in the first place. And secondly, how quickly heat is lost from the body. So these are the two factors, two major players, is how much heat we produce and how quickly the heat is lost from the body. Your body temperature is not uniform. That means all parts of the body are not at the same temperature, especially in colder season. When I am covering my body with warm cloth, then that area will be warmer naturally, and my fingers and toes may be colder. So that is why some areas remaining much warmer than others. While the temperature in your core may vary only by some 3 degrees centigrade, this variance can be as much as 30 degrees centigrade in the fingers and toes. Therefore, getting cold hands is not in your imagination. They really can get a lot colder than other parts of the body. So sometimes people may say, oh, you are imagining, you're feeling cold. No, feeling cold is definitely happening. And what does it depend upon? Our body temperature is regulated by an area of the brain called the hypothalamus. Hypothalamus, which acts as a thermostat. So this hypothalamus is a thermostat. When you get too hot, the hypothalamus dilates blood vessels near the surface of the skin to release heat. And at that time, what will happen? The skin appears flushed and sweaty. When you are cold, the hypothalamus constricts these blood vessels to conserve heat, making your hands and feet cold. So everything works on the functioning of the hypothalamus. If too much heat is lost, then muscles spasm, shiver, they produce heat. This is known as the shivering reflex, and it is totally voluntary. It is, totally involuntary. You don't have to do anything. It is an involuntary action, this shivering reflex. And this action, please pay attention. This action nowadays is being detrained. Detrained means our body has a natural instinct to shiver, but when we overprotect ourselves, overprotection I will explain later. When we overprotect ourselves, then this shivering reflex slowly gets numbed. It just vanishes. What is the example of overprotection? That means when there is a small weather temperature change, either it can be temperature change for hot or for cold. I will discuss both. So shivering reflex happens only when the temperature change is for the cold temperature. But still, in both cases, we are buggering up our body system. What is it? When there is a temperature change like that, we should not immediately rush to some solution, artificial solution. For example, if there is a slight cool breeze, immediately we should not cover up. We should not take a shawl immediately. You can't take a shawl if you are sick. That is a different issue. We are talking of normal, without any major sickness. Then you should allow the temperature, you should allow the cool air to touch the body. Then the body will automatically start shivering if the temperature is much colder than the body can tolerate. Then it will start shivering. But if you start immediately reaching for a shawl or a rug or whatever, then what will happen? The shivering reflex gets muddled. It just gets slowly, then it will stop also eventually. Because it is a group of muscles. All of you know that every muscular activity requires training. So muscles require training. So that is why I say, do not immediately rush for a rug. Similarly, when the weather becomes warm, do not immediately rush to switch on the fan. Let the outside, stay in a good ventilated place. Let the outside temperature, let the outside air come and stroke you. That is very good. Or stay in a place which is far away from the fan. You can switch on the fan if you like, but don't stay directly under the fan. Do you know, you must have noticed it. You are coming from outside. You have gone in the sun. You are coming from outside. You are coming inside. Then immediately, what is our instinct? To switch on the fan. For few, say maybe 1 minute or half a minute or 2 minutes, we do feel better. But does it last? Do you later on feel happy being under the fan, even though the fan is in full swing, 5 number regulator? No. After some time, you feel still hot. Why? Because that was a temporary relief and it does not sustain. But suppose you put the fan in one and you stay far away from it, then what will happen? Gently the body, the wind will come on the body and it will slowly reduce the perspiration. And then as a process, the body temperature will automatically drop down. You can try it and see. Anytime you try it, you will understand my logic. And I will even give you the another example of this. You know, when before we had fridge, you know, matka, earthen pot. We keep water in the earthen pot. And then what do we do to keep it cooler? To make it cold quickly? What do we do? We just wrap a thin cloth, white cloth around the matka, around the pot. And you will see that within short time, that pot becomes cooler, cold. Why is it so? Because the cloth is slowly removing the heat from the matka, from the pot. And the moment some heat is removed, immediately water from inside comes in through the pores. That same principle I am telling here. When you are allowing the sweat to evaporate very slowly, then you will feel you're really getting cool. Whereas if you sit under a fan, then for about 1 minute, the surface skin, the perspiration of the skin has evaporated, but after that the body has not cooled because it has evaporated at a speed much greater than it can remove the heat from the body. So that evaporation process has been hampered. That is why I say do not overprotect. Understand now? So I have given the example for cold temperature as well as hot temperature. Yet if you find yourself, this is again, the hypothalamus also controls the thyroid gland, which is largely responsible for the process of metabolism. You know, metabolism means catabolism plus anabolism. Catabolism means breaking down the food into useful pieces, let us say. And then anabolism means recreating fresh material from that broken up material. So metabolism means catabolism, breaking down, and anabolism, that is the breaking this thing. Okay, so breaking down, and then the anabolism means recreation, synthesis, let us say. So that is called metabolism. And that is dependent only on the thyroid gland. In fact, the thyroid gland is called a metabolic hormone. The thyroid hormones, they are called metabolic hormones. So that is responsible. This metabolism determines how much heat is produced by the body. When either the thyroid gland functions less efficiently or when circulation is compromised, you will feel cold all the time. So that means when the hypothalamus is not functioning properly, then also this thing is there, the feeling cold is there. Then when the thyroid gland is not functioning properly, or when there is poor circulation, so these are the three main players. And for that, there is one treatment which is called, for the hypothalamus, we have a treatment called 6 medulla. Now, medulla treatments I have already shared in the group, Joshys group. So you have, there I have shared a 15 medulla or 8 medulla, something like that. You remember 6 medulla is slightly different. Okay, but the process is the same. I do 6 pairs on the left side and 6 pairs on the right side. Process is the same. 6 medulla, and then even 6 medulla and 4 thyroid. You just keep your finger like this and just give gentle jab. 1, 2, 3, 4. Just this much. 6 medulla and this is enough to start with. Of course, otherwise we have got a treatment called withdrawal treatment. Okay, which is a longer treatment. So that also can work. But remember, just taking one formula and trying to work on it is not a correct attitude. You must go to the constitution of the body. You must go to the root cause, and for that you require investigation. I am giving you some solutions, but I always recommend that please come for a consultation if that solution is not working. Don't just give up. Just say, no, it's not working, I give up on neurotherapy. No, that is not the correct thing. You come for a consultation, let us find out what is the problem, and then we can help you. So many people have got benefited. Is that okay? So that means now we will see one by one all these major players. The first and the most important topic for today, it's called anemia. Now, all of you know about anemia. You're all healers. All of you know about anemia. I am just going to give you certain important points about anemia. Okay. So anemia, what is called anemia? When your system, that is your body, can't make enough normal red blood cells to carry oxygen throughout your body. So that means anemia is basically a manufacturing defect. I'm sure you understand this language. Manufacturing defect. So a manufacturing defect, can't it be rectified? It is not a disease in that sense. If I know where the flaw is there, if I know how to set right the manufacturing process, I can get solution. Isn't it? So anemia is not to be feared. Of course, it takes some long time sometimes. Okay. There are several different types of anemia. And the tendency to feel cold is a common symptom for many of them. But the most common form of anemia stems from iron deficiency. When you don't have enough iron in your blood, why is iron deficiency the problem? Because when you don't have enough iron in the blood, you can't make sufficient hemoglobin. And hemoglobin is the protein that allows your red blood cells to transport oxygen and carbon dioxide. So when you can't make sufficient hemoglobin, then it leads to less circulation to your limbs, and that is why you feel cold, particularly in your hands and feet. Now we will say, what are the symptoms? The symptoms of anemia, they vary according to the type of anemia. Then according to the cause, the underlying cause. Then severity and any underlying health problem. What are those health problems? It could be hemorrhaging, bleeding somewhere from within. It could be ulcers. It could be menstrual problems or cancer. Cancer, of course, is a major issue. We don't normally talk about it, but these things, hemorrhaging, ulcers, and menstrual problems, for each one of them, neurotherapy has got a solution, especially for menstrual problems. So specific symptoms of those problems may be noticed first. So depending on which is the cause of anemia, the specific symptoms will be there. And another thing, the beauty is the body has a remarkable ability to compensate for early anemia. That means if your anemia is mild or it has developed over a long period of time, then you may not notice any symptoms. That is why everybody, unless the anemia becomes a real problem, it is not noticed. But if you took proper care of your diet right from the beginning, then it won't set in easily. That also is there. So what are the symptoms, common symptoms? I will later on list out the particular symptoms for each anemia also. But now the common symptoms. Most important, looking pale. You know, the body doesn't have a color. It's looking pale. Then easy fatigue and loss of energy. You can't do much work. You feel tired. Diabetics face this problem often. They feel tired. And then there is an unusually rapid heartbeat. It's called tachycardia, and particularly with exercise. And for this type of a problem, neurotherapy, we have a wonderful solution. It is called angina treatment. So angina is the treatment, and especially for rapid heartbeat, we have got something called 10 right medulla. So 10 right medulla and angina treatment works wonders for people who have an unusually rapid heartbeat and particularly with exercise. Then shortness of breath. That means you take shallow breathing. And headache, particularly with exercise. Again, headache also. Some people get headache with exercise. Why so? Why they are getting headache with exercise? Because when you are doing exercise, the oxygen content of the body reduces. Carbon dioxide content in the blood increases. And the brain requires good oxygenated blood. And when the percentage of oxygen goes down, and when I say it goes down, don't think it goes down by 10% or 20%, only 4%. Only 4% carbon dioxide is in the blood. But that 4% is enough to cause problems, not having that 4%. So the oxygen carbon dioxide ratio is a major issue. And that is why you get headache with exercise. Then since the brain is not getting proper oxygenated blood, naturally you will have difficulty concentrating. See how it is linked. And then naturally you will get dizziness also. And pale skin, I have already told earlier. Sometimes some people may get cramps. And insomnia. Insomnia means inability to sleep. So these are the general symptoms common to many types of anemia. So now let us come to the most common cause. Anemia caused by iron deficiency. Now iron is a critical part of the blood. It helps red blood cells, RBC, to carry oxygen around the body. Remember, RBCs are the real coolie. The oxygen carrying carriers is only RBC. Okay, and hemoglobin is inside the RBC. So the hemoglobin is carrying. But if the RBCs are not proper, as we will see later, we have some diseases of RBC, then the oxygen carrying capacity will become less, even though the hemoglobin is there, but the RBC is defective, then it cannot carry oxygen properly. So this, once oxygen is properly carried, then only each cell can function properly. So how does this affect thermoregulation? Thermoregulation means the regulation of temperature. How iron deficiency affects thermoregulation? It affects in two different ways. Number one, a lack of iron impacts the thyroid. I told you thyroid is the metabolic hormone which is responsible for temperature. So a lack of iron impacts the thyroid, making it less effective at generating the heat that your body needs. So if the thyroid is not functioning properly, it may not be called as hypothyroid yet, but it is not functioning 100% okay. So then what will happen? It is not able to generate the heat which your body needs. Then lack of iron affects circulation. So when your blood does not contain enough iron, then it is hard, because the iron means hemoglobin. So naturally, if the blood does not contain enough iron, then it is harder for your cells to get the oxygen that they need. So blood flow can therefore increase to counteract this issue. So what will happen? Blood flow will increase, but then in doing so, more warmth is lost. The body loses warmth because more hot blood flows near the surface of the skin. So it flows near the surface of the skin, hot blood, and then it becomes cool. That the skin is, that tips are having cold temperature. So it is not able to heat up the body properly. Now, who suffer from this? Women suffering from anemia experience considerable improvements in body temperature after supplementation. So for this, iron supplements are recommended, and then by these iron supplements, they found that women suffering from anemia can experience considerable improvement in body temperature after supplementation. And women of childbearing age are particularly prone to iron deficiency due to the monthly menstrual cycle, and may find that feelings of coldness intensify each month with the loss of blood. So whenever during their periods, when they lose blood, then their feeling of coldness may become more. And what are the other symptoms? Other symptoms to watch out for include pale skin, dizziness, extreme fatigue, and irregular heartbeat. Now we have, as I said, we have solution for each one of these. Okay. People, so pale skin, of course, you will require iron, the iron supplement. Pale skin cannot be just wished away. But dizziness, etc., the moment your hemoglobin content becomes better by supplementation, dizziness will go away, extreme fatigue will go away. And as I said, irregular heartbeat, we give 10 right medulla if it is fast. Okay. Then people, what are the symptoms of iron deficiency anemia? This is a very peculiar thing. It is called pica. Hunger for strange substances such as paper, ice, or dirt. You know, this is especially for ladies. For ladies, those who are having anemia, sometimes they may feel like eating tuna. Those who are, especially those who are having calcium deficiency, they will feel like eating tuna more. And in the good old days, when people used to have chula means mud oven. At the time, some ladies will eat just a portion of that mud oven that contains natural calcium. Okay, so like that, from that everybody can understand that that they are having calcium, they require calcium in the body. But this is a hunger for strange substances such as paper, ice, or dirt, and that is called pica. Then there is an upward curvature of the nail. This is known as scolionechias. Now I'll show you what is scolionechias. So this is scolionechias. You see this curve, upward curve. This is typical of iron deficiency. It is looking like a spoon, you see. It's becoming like a spoon. iron deficiency. Then soreness of the mouth with cracks at the corners. And what is the solution? Iron supplements and eating iron-rich foods such as lean meat. For non-vegetarians, lean meat and eggs. And for vegetarians, it is leafy greens like spinach and kale. They are also beneficial. So these are the solutions, simple solution. And of course, in neurotherapy, we have got a liver treatment that is called 1-point liver into 6, and that is a very good treatment for iron deficiency cases. Then you have an anemia caused by vitamin B12 deficiency. It is called pernicious anemia. So along with iron, vitamin B12 plays a crucial role in the production of red blood cells. Just the same, a deficiency may lead to persistent feeling of cold. That means if anybody is having vitamin B12 deficiency, it is called pernicious anemia, and it will also produce coldness in the body. So what are the special sensations for vitamin B12 deficiency? Tingling, pins and needles sensation, like some small pins are pricking in the hands and feet, like this pins are pricking, that feeling. And this is a very common feeling, okay, for many people. Then you have lost sense of touch. You touch them, they are not able to feel the touch properly. This in, in diabetes it happens that especially in the feet, they cannot feel the sensation of the ground. They feel that they are walking on a carpet, even though they are walking on hard ground. Why? Because that sensation is lost. Sense of touch is lost. And that is because of methylcobalamin. That is set right by methylcobalamin. That is the active form of vitamin B12 in supplement. Okay. So methylcobalamin means vitamin B12. Okay. And that all diabetics know that they are given this treatment, methylcobalamin tablets or B12 tablets. Then wobbly gait and difficulty walking. Whenever you have vitamin B12 deficiency, your gait won't be proper. You will slightly go like that. Difficulty walking because the legs are affected. Then clumsiness and stiffness of the arms and legs. Here I want to add something. Suppose you are sitting on a sofa and then you are leaning your hand on the sofa, keeping it like this you are keeping. Okay, let us say you are keeping it like that. And then after some time, you notice this place is becoming numb. That is a classic sensation of vitamin B12 deficiency. You don't require even to go to a doctor. If this sensation is there for you, you check your vitamin B12 level, it will be less than normal or it will be very low. Similarly, suppose you are traveling in a bus and you are catching the rod upstairs, up above your head, you are catching that the hand rest, you have to catch for maintaining your balance. And suppose after some time you feel tingling sensation here or here, that again is a sign of vitamin B12 deficiency. So I have given you two practical, and these are not written in the book. They are not written in the internet. That is the unfortunate part. It's all simple, symptoms. And then according to neurotherapy, we have got another symptom, very rarely known by other doctors. Okay, I don't know whether in your acupressure, acupuncture, whether you have come across this symptom or not. This is the left hand. Okay, now this corner, see this corner, the distal joint. This is the proximal joint. You understand? This is the proximal joint and this is the distal joint. The distal joint, if it is black, you will notice it. Here it is not, it is fair, here it is fair, but here it will be black. Understand? Here it is fair, here it is fair, but here it will be black. Similarly, here it will be black. Now here, all these 4 lines, if it is black, then it is a sign of vitamin B12 deficiency. And here, if it is black, it is a sign of niacin deficiency on the left hand. Similarly, on the right hand, here, the proximal joint, if it is black here, it denotes thiamine deficiency. And if it is black here, in the first, it denotes folic acid deficiency. So, left hand, vitamin B12, right hand, folic acid. Then left hand, niacin, right hand, thiamine. Now you can all have your own this thing. This is a general rule. There may be some exceptions. Somebody may not have a folic acid deficiency, but still they are having blackness here, etc. Or somebody is having folic acid deficiency, not having blackness here. That's also possible. Sometimes it happens. But in general, this is a very simple, let us say, yardstick. And symptoms will be there. These symptoms which I have mentioned here, all those symptoms will be there, or some of them will be there. When you have vitamin B12 deficiency, these symptoms will be there. So that is inevitable. Okay. So then there is dementia. This is niacin deficiency. Dementia is also associated with niacin deficiency, and you know Alzheimer's disease, that is dementia, a classic example of dementia, Alzheimer's disease. Okay, and that is in neurotherapy we have found that we have got pain points for these four this thing near the femur bone. Okay, so we have found that people who are having Alzheimer's, they are having severe pain in the niacin pain point of neurotherapy. So by treating that itself, we are able to get some results. So what is the solution? Vitamin B12 is found primarily in animal-based foods, such as lean meat, fish and dairy. Many people are having fish and dairy as their diet. They may not have this vitamin B12 deficiency. But for vegetarians, they have to take vitamin B12 supplement. One of the supplements is known as spirulina. You might be knowing about it. And another thing, this is supplement. Sometimes you are taking supplements, still you are not getting the result. Why? Because that is because of malabsorption. That means your digestive system is not all right, and as a result, this is happening. And here I will tell you one thing. This vitamin B12, he is very, very touchy character. In Hindi, we have a word called nazuk. Nazuk. Nazuk means very touchy, very, very easily damaged. So it requires a bodyguard. Really, it is like a princess who requires a bodyguard. And what is the bodyguard? The bodyguard is made by the body. And that bodyguard's name is intrinsic factor. Intrinsic factor. And this intrinsic factor, where it is made? It is made in the stomach. That means people who are having poor stomach digestion, that means poor blood supply to the stomach, will have intrinsic factor deficiency, which will lead to vitamin B12 malabsorption. So you understand? So taking supplements alone is not the solution. You must have good blood circulation to the stomach. Then you may ask, is there any way of knowing whether I am having good circulation in the stomach or not? Yes, it is there. Very simple in neurotherapy. I will show you. Just look at this. We will stop this share for some time. We will pause it. Okay. Now I will. Now you are looking at me. I think I should stop share for the time. Yeah, then you can look at me nicely. Okay. So now see, this is the sternum. This is the sternum bone. Just below the sternum bone, over here, the first point, just immediately after the bone is finishing, you have a depression. Okay. So this depression, this depression, we call it you all know it as the solar plexus, and we call it the pancreas pain point. Just below that, this region below the depression, this is the region of the stomach. That means any pain over here, by touching, if I am feeling pain or hardness or stiffness, then I can understand my stomach is not getting proper circulation. And in neurotherapy, we have a treatment called CNS gas, all three sides. I have shown this already in some of my earlier classes. That is a very good treatment for reducing this stomach pain, this pain. And that is helpful for intrinsic factor. So we have pain points for B12. We have pain points for intrinsic factor, the stomach. So once these pain points, these are the root cause. So once these pain points, that pain is removed, then obviously the patient becomes all right. The patient is happy. So I hope you have got this solution nicely. Then we'll continue. Okay. So now here you see pernicious anemia. Now you see, as mentioned, pernicious anemia, it is supplements is dietary B12, that is mainly from fish and eggs. And for, of course, vegetarians, I told you, you require supplements, but more than supplements, you require the stomach, this area, to have proper circulation. Then only intrinsic factor will come. Okay. And after that, this forms hydroxycobalamin, etc. Okay. Yeah. Okay. So we continue. Now, if this intrinsic factor is there, then it will form a bodyguard. It will act like a bodyguard for vitamin B12. So like a bodyguard protects its master, the intrinsic factor will protect vitamin B12, and then it will take it through the digestive system, because as I said, it is very nazuk, very delicate. So the stomach acid will also destroy vitamin B12. Intestine, there are lots of alkalis over here, they will also destroy vitamin B12. But when intrinsic factor is there, then they cannot destroy. That is the beauty. Okay. So like that, it goes to the terminal ileum, and from there in the ileum, the villi, it is absorbed and sent into the blood. And if it is not properly absorbed, then you have numbness, you have all those symptoms. Okay. So now we come to another important, this is not so common, it is a bit rare, but still it is there. Anemia caused by chronic lead poisoning. Chronic lead poisoning may lead to these symptoms. A blue-black line on the gums. This is called lead line. Okay. Blue-black line on the gums. So if anybody is having blue-black line on the gums, please check up your lead level. Okay. Doctors can tell you perhaps, definitely. Okay. So they will tell you what test to be made. Then, since it is poisoning, abdominal pain is very common. And then constipation and vomiting. So these are all the symptoms of anemia caused by chronic lead poisoning. Then anemia caused by chronic red blood cell destruction. So red blood cells can also be destroyed very easily. And so anemia can be the result of your body making too few red blood cells, RBCs. The body is making too few RBCs, or it is destroying too many RBCs. You all know that the spleen is the coffin of the RBCs. Spleen is the coffin. So either the body is making too few RBCs, or the body is destroying too many RBCs, or else losing too much blood for some reason. So anemia caused by chronic RBC destruction may include these symptoms. Number 1, jaundice, that is yellowing of the skin and eyes. Number 2, because it is making a destruction of RBCs that can appear as brown or red urine. Because finally, anything which is destroyed in the body has to be removed through the urine. Okay. So you may have leg ulcers, or failure to thrive in infancy. Failure to thrive means being very thin, skinny, not having proper health. And then in some cases, it can be symptoms of gallstones. So these are all the symptoms of anemia caused by chronic red blood cell destruction. And for almost all these, for jaundice, the treatment is 1-point liver. Liver is already known. Then for brown or red urine, of course, you have to drink a lot of water, and then you have to find out why the spleen is destroying too many RBCs. And the pain, whenever there is spleen is overworking, it is called splenomegaly. Megaly means becoming bigger. The spleen becomes bigger in size. And you also in TCM, etc., you must be having your own diagnostics for spleen. In neurotherapy, what we do, we say that the pain in this area, this is called spleen area. Okay, this area, anywhere along this rib on the left side. This is my left hand, left side rib. This is the pain of spleen. And for this, we have a simple treatment called Raman treatment. Okay. So that can help. So now, gallstones, for gallstones, again, 1 point liver is very good. Or 1 point gall, 1 point liver into 6. That's a very good treatment for gallstones. Okay. Now we come to another very important this thing. It's called sickle cell anemia. Okay. Now this is a normal RBC. Okay. Look at this. Whereas this is a sick RBC, it's called sickle cell anemia. Sickle cell. This is, see, looking like a sickle, no? With which you cut grass or dhan in the field, paddy, etc. So that type of a formation. And naturally, when this type of formation enters the capillaries will all be just cut. That is why when there is sickling, this is too much of sickle cell is called sickling. When there is sickling, the person will have severe pain. And what are the symptoms? Fatigue, especially in crowded locations. You see, here normal RBC, here sickle cell RBC. Sickle cells, these are sickle cells. Okay. So here there will be fatigue, especially in crowded locations. Because you see, the sickling invariably takes place when there is less oxygen in the body. And in a crowded location, you can understand the oxygen will be less than in other places. So at that time, there will be sickling, and then that can be tremendous pain over there, and there can be fatigue or susceptibility to infection. Okay. Or in children, it happens, it causes delayed growth and development in children. Delayed development. Then episode of severe pain, I told you, because the capillaries are getting cut. So in the joints, abdomen and limbs, there will be severe pain. This is it. Now, sometimes there may be sudden RBC destruction. So symptoms of anemia caused by sudden RBC destruction. See here. See here, chronic. One is chronic RBC destruction. This is chronic RBC destruction. This is sudden RBC destruction. So in there also you will have abdominal pain, blood or red urine, jaundice. These are common to the above also. But here you have small bruises under the skin. Small bruises under the skin develop. And you may have seizures. Okay. And there may be symptoms of kidney failure. So many reasons, so many symptoms for identifying the type of anemia. Some are overlapping, but some are unique. So you can easily identify. And naturally, depending on the cause, treatments also may vary. Now we come to another important thing, anemia due to and during pregnancy. So what happens in pregnancy? In pregnancy, the blood volume goes up by about 20 to 30%. 20 to 30% blood volume goes up. And that can dilute RBC concentration. And this is the reason why iron is a key component of prenatal vitamins. So then it can cause iron deficiency. Why? Because the fetus uses the mother's RBC for growth, especially in the last 3 months of pregnancy. This is known to everybody. All of you know it. And vitamin B12 is important for RBC formation. Actually, it is more important for RBC maturation. vitamin B12 and folic acid, they are important for RBC maturation. So now what is this maturation? Like, when you say a girl has become mature, what does it mean? She is ready for motherhood. That means the work for which she is born, let us say, one of the jobs. Similarly, an RBC, if it is to mature, then it must have a reduction in size. When an RBC is first formed, it has got a diameter of 45 micron. 45 micron is the diameter of an RBC. Now, the diameter of a capillary is approximately 7 to 7.5 micron or 8 micron, something like that. Now, a 45 micron RBC cannot enter a capillary at all. And when that happens, when the RBC does not lose, it does not get reduced in size, it is called megaloblastic anemia. Megaloblastic anemia. That is when an RBC is big in size and so unable to enter the capillaries. But when we give folic acid supplementation, then this megaloblastic anemia, that RBC, becomes less in size. So that is the reason why folic acid supplement is absolutely essential for pregnant mothers. And similarly, vitamin B12 works in a different fashion. It also is necessary for maturation, for this size reduction. The RBC has to size reduction, then its nucleus has to be formed in a different way. For all that, this is very useful. Now, folate, called folic acid, works with iron to help with self-growth. So much we spoke about anemia. Now let us come. So I hope all of you have got some benefit, you have got some knowledge, and naturally we can put it to practice. Okay. Of course, I have already covered many of these in my classes. Now still, since for newcomers, somebody may not be knowing what is CNNS, gas, all three sites, I will show now. Okay, now we have covered anemia. Now we will come to hypothyroidism. But before that, I will stop share and then I will show. Okay. Now, okay, now we will see. One minute. Now, for those who are able to sit like this, it is okay. If you cannot sit like this, you can put a pillow over here, 1 or 2 pillows here you can put underneath your legs. That is enough. And now I am showing what is known as CNNS, gas, all three sides. Now I will show first one, the center side, and then I will explain how the others have to be done. Okay. Now this is my left leg. This is my left leg. So I will show now one leg at a time. This is my left leg. Okay. This is my left leg. Okay. Sorry. This. Okay. Now you can see here, this is the Vajra Nadi. The Vajra Nadi is going like this. Okay. Now I keep my finger like this. All of you can practice with me if you like. Okay. And I keep my hand like this. Okay. And I keep my finger like this and I press. See, this is where the ankle bone, from here I am going to press now like this on this line. I am going to press. I'm going to press like this, and then I'm going to come here, and here before the nail ends, I will bend it. Okay, so now you see how it is to be done. This is just one technique. See, I am keeping my finger like this. I am pressing downwards. I am pressing downwards. Okay, so I press like this. I press like this slowly with pressure. I am going down. I am going down. I am going up to this thing, and here I am just catching hold of the finger like. And here I am maintaining 6 seconds. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Slowly I release. I do this 3 times. Second round, I do like this. Then catch it down. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Slowly release it. Third, last round. Like this. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Then slightly shake it. Okay, sometimes there may be pain over here. Don't fold. If there is too much pain, don't go so much. For me, I am able to do it because I am regularly practicing. Suppose you can do only this much, it's all right for the time being. Then later on, slowly you will practice like this. Slowly like that. Okay. So this is one. Then you imagine this. Yeah, exactly. So now this was center. Now I place my finger like this. Okay. Now this is my left side. This is my right side. Okay. So I place my finger like this, and I go to the left of this Vajranadi. This is the Vajranadi, let us say. And then I go to the left of this. I place my another hand, I place here for support. Then I press like this. Slowly I press. I am now pressing inwards like this. I am not pressing straight. I am pressing inwards. This one was pressing straight. Now this is pressing inwards. So like that I do. Like this. Slowly I do. Then I go from here. I then come to the, once I come here, again I come to the center, and then again I fold it. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Slowly I release. Again, I repeat. I repeat like this, go like this, then come to the center, and then 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Last round again on this left side, like this, and then come. You don't have to do very slowly. I have done fast. You can do like that also. Okay. But there should be slight pressure. Okay. Now I did 3 here. I did 3 on the left side. Now I do 3 on the right side. So I start like this. This is the center. So I am starting from the side. I start like this, keeping my hand like this. I go from here like this, slowly. Now again I come to the center. Then here 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Then I release it. Again second round. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Third round. So this this is now 9 places. So this 9 together is called CNNS gas. This is on the left leg. Similarly, when I do on the right leg, it will be other side. Right leg also same way. I can use my left hand, or I can use right hand. I can do with any finger. Doesn't matter. So these two together, this is called CNNS gas, all 3 sides. Now, I also have a shortcut. Some people may say, sir, this is too much, sir. How to do for so long? It is too much for me. I don't have time. I have got a solution for you. Follow it. This I have shown this earlier also. Now, Just see me. See, I am keeping both my hands like this and both my fingers like this. Okay. Now I am starting from here. Both hands. See, I am keeping my. You don't have to keep like this. You can even sit like this and do it. But to show, I am doing like that. Okay. So now I am keeping my hand here. You see, for both the hands, I am keeping it here. Okay. So I am keeping my hand like this. Then slowly with pressure, I am going on the Vajranadi, and then I am bending both together. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Slowly release. Then again, second round. 1, 1, 2, 2, sorry, 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Third round. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. So if you don't have time, at least do this. At least do this. You can repeat this. Another 3 more times you can repeat. So we did only 3 times. Even this is okay. If you do all 9, very good, wonderful. But if you cannot do 9, suppose you have no time, do at least these 3. Then the question that you will ask, when should I do it? Very good question. When should be done? What are we doing? What are we using it for? This is for the Vajranadi. This is for improving digestion. So when should we do it? The best way to do it is just before meal. Just before meal. 2, 3 minutes or 5 minutes, or even immediately before a meal. Means you are sitting on this thing you are going to eat, immediately do this and start eating. You can do this. Okay. So that is the best. Of course, I have got another longer solution called digestion absorption formula, which if you have time, we will do it another day sometime. But mainly, this is enough to start. If you do not start, you are not going to see the result. But I have seen many people saying that they are getting very good results in the diabetic challenge group. Many people have confirmed that they are getting very good results even with this treatment. CNNS, gas, all 3 sides. Okay. Okay. So now we have now covered anemia to a certain extent. 1-point liver. Yeah, somebody may say, you have not shown me 1-point liver. I will show you 1-point liver also. Very simple. Though it has been covered earlier, because of newcomers, I am showing. Now, this is normally given in 3 locations, only on the left leg. This is the left thigh and the left hand. Only left hand, not on the right. Not on the right. So what I do, I keep my hand like this. Now with the palm of my hand, I am pressing on my forearm, and the back of the forearm, it will press into my thigh. That means simultaneously I am getting pressure over here and over here simultaneously. Of course, if I lie down, somebody else can do it for me, then it is very good, no doubt. But if somebody is not available, then this is enough. Okay. So, okay. So what I do? So I am going to give pressure first on one location, second location, third location. Similarly on the hand, first location, second location, third location. And I am going to press with my hand, palm, flat of the palm. So I press like this. I press like this, and this region presses here. So I pull inwards, not like this. It should not go out. It should be inwards. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Then I wait for 1 minute. waiting for 1 minute is useful. At least 40 seconds, at least you should wait, and for good results. Then you go to the next point. So first point was here, next point is here. And here it is the second point here. First point here, second point here. So I keep like this, and I can keep like this or like this. Okay, I am keeping here to show you all. Press inwards, press like this. Okay. 1 1, 2 1, 2 2, 2 3, 2 4, 2 5, 2 6. Okay, then wait for 1 minute. Then go to third position here, near the elbow and near the kneecap. But don't keep on the knee. Don't keep on the knee. Slightly below it, fleshy portion. Here it is bone. Don't keep that. Keep on the fleshy portion. And again, pull inwards. So like this. I pull inwards. 3 1, 3 2, 3 3, 3 4, 3 5, 3 6. So 1 2 3. Again after 1 minute, I repeat 4 5 6. Okay. So this is called 1 point liver into 6 treatment. Wonderful treatment. And now you have got some basic knowledge about certain points for anemia. And then even for COVID, it works. These points. I have got one video. I think I have shared it in the group already. I'll check up. Otherwise, you can share it. That is called 60 toe finger gall liver into 3. So that 60 toe finger gall liver is excellent for many things, including COVID problems. So that video is there. I will share it if necessary. I will share it again. I think it is there in the group already. If you can locate it, very good. Otherwise, somebody can write to me 60 toe finger gall liver. I call it 60 TFGL. TFGL means toe finger gall liver. 60 TFGL into 3. You can note it down, and you can find out this video in the Joshys Kerala Group. Of course, those who are in diabetics group, they already know this. I have discussed this already. But for newcomers, you can locate it. It's a very good treatment for pains, aches, injuries. Okay, for many things. And I keep mentioning about it in the replies. So you can all. Then another treatment I would like to, I have shown this 8 medulla. I will just show you because it's good for sleep. Everybody can have good sleep today. So very simple. We are using 2 fingers. We start on the left side and end on the right side. Okay. How it is to be given, I will show you. Very simple. So I start, you see the bone over here. You see the bone here. From here vertically down, I have to go. Just vertically down. You have to go, and you must do 8 pairs. For 8 medulla, 8 pairs. For 5 medulla, 5 pairs. For 6 medulla, 6 pairs. However medulla, that many pairs. 30 medulla, 30 pairs. Okay. And usually it is done on both sides. Some cases I will write left medulla. Then you should give only on the left leg, left neck. If I say right medulla, you should give on the right neck. Simple, very simple. So now from here to here, you know, in neurotherapy, we have got almost 170 points I want to teach. But a few of them are quite complicated. That is kept for those who really want to learn neurotherapy completely. For them, we have a 6-month course, a 1-year course, like that. But for general patients, I think what basic knowledge I am giving can start. Then you can attend my special classes. I hope to conduct a special class for high blood pressure. And then maybe I will repeat diabetics again, because there are many diabetics still left who have not attended my earlier classes. So like that we can go on and you can see the results. So now I am going to teach 8 medulla. This is for good sleep. This is for calming the nerves. So let us see. I keep one finger like this and I keep another finger like this. I am going to give treatment with this portion and this portion. So you see now how I give 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8. And then last one always hold for a few seconds. Okay, just hold for a few seconds and then release. So this is 8 medulla on the left. Now 8 medulla on the right. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8. Left and right together makes 8 medulla. Okay, so 8 medulla I have shown. This is very useful. The medulla treatments are very useful. Wide, but they are not, you cannot just say, give me, somebody had written sometime, give me the medulla for something. For one thing alone, a medulla treatment may not be there, but a medulla treatment may do certain things. Because you see, some may be complicated issues. For that, I cannot, just giving one medulla will not help. But giving 8 medulla, it will help you with sleep. It will help you with calming the nerves. You know, in the diabetics challenge group, one day one thing happened in one of the earlier classes. One lady, as I was asking her to do 8 medulla, she did. And then she said she went to sleep for some time on the spot, in the class. And that is how powerful it is. I will not say everybody will get sleep immediately. That lady was lucky, and the beauty is that she immediately told us in the class. So then many people started trying it out and they got results. So that is why I'm saying this 8 medulla is good for sleep. Of course, there are many versions. I have got something called full serotonin formula. There you would add something more. We will see, we will cover it later in one of the other classes. So today, now we have covered CNS gas, all 3 sides. We have covered 1 point liver. We have covered 8 medulla. Now let us go ahead with hypothyroidism. Okay. Now we all know that the thyroid is a butterfly-shaped gland at the base of your neck. What does it do? It helps control metabolism. And what is metabolism? The chemical reactions that happen throughout our bodies that provide energy. So these are chemical reactions. It happens throughout our bodies. That means not for only one gland, not for only one place. It happens throughout the bodies. And what its purpose is? Its purpose is to provide energy. Okay. Okay. Now, if this gland does not make enough thyroid hormone, or if your body cannot process that hormone effectively, you may develop hypothyroidism. And simple blood test for TSH, we all know there is a TSH test. So that tells us if we have this problem or not. And what happens? The thyroid hormones travel through the bloodstream and affect nearly every part of the body, from heart, brain, muscles, skin, everything. So now hypothyroidism is a condition in which the thyroid does not produce sufficient levels of the metabolic hormones. So then that means it slows down. and it can happen for various reasons. The most common being Hashimoto's thyroiditis, Hashimoto's disease, it's called. It is an autoimmune disorder that prompts your immune system, our own body immune system attacks the thyroid. That is the beauty, that is the bad luck. It is like our own policeman attacking good, honest citizens, like that. That is exactly an autoimmune disorder. The body protective force, which is supposed to protect the body, hits certain, damages certain glands or certain organs or certain cells. Okay. And who can develop this hypothyroidism? A woman, ladies, if you are over 60 or if you have type 2 diabetes. So type 2 diabetes is very prone to hypothyroidism. And as we said, thyroid controls how the body cells use energy from food, and that is called metabolism. So what are the things it affects? Body's temperature, body's temperature, heartbeat, how well you burn calories, all these things are affected by metabolism. So if you don't have enough thyroid hormone, your body processes slow down. And this means your body makes less energy and your metabolism becomes sluggish. So that's why I said, every time a little bit hypothyroidism is there, it will not show in the report. Don't say my TSH is all right, so I don't have hypothyroid, but I have these symptoms. If you have symptoms, what are the symptoms? We will see. If you have those symptoms, that means your thyroid is not functioning optimally. Since the slow thyroid affects a bunch of metabolic functions, hyperthyroidism can cause a wide range of symptoms, including fatigue, unintended weight gain, constipation. This is a very common this thing of hypothyroidism, constipation. Then dry skin, thinning hair, depressed mood. So all those things here it is written. Let us see here. So and irregular periods. And an increased sensitivity to cold, which is what we are now talking about. We are talking about low body temperature. So that is why this paragraph is important. Okay. Increased sensitivity to cold. Okay. So besides feeling cold, other symptoms include thinning of the hair, dry skin, fatigue, irregular or heavy menstrual periods. So either the flow will be too much, or flow can be too much, or else it can last for 5 days, 6 days, 7 days, 8 days. The flow will be there. That means it is the thyroid control is not there in the body. Whether it shows as hypothyroid or not, this is the function. This is the fact. Thyroid control is not there. Then, so these are some of the points. Now, what are the other reasons for low body temperature? Blood vessel problems. So blood is a specialized body fluid. It has got 4 main ingredients. Okay. Plasma is the liquid part. So plasma contains 92% water, and it also contains a very important proteins involved in blood volume and immune system and clotting. So these many things are involved with blood vessel problems. And the most common blood vessel problem is called atherosclerosis or arteriosclerosis. If you feel cold in your hands and feet, you may have a blood vessel disorder in which blood flow to your arms and legs is restricted. So this is what is happening to some people. Spending long stretches of time without moving your legs can cause what is known as deep vein thrombosis. It is normally written as in short as DVT. Many people may be knowing. And for DVT, we have a wonderful treatment called heparin treatment, and that is wonderful for DVT. And DVT, deep vein thrombosis, means blood clots in the legs. And this happens for during flight. People who are having 8-hour flight or longer flights, they have a problem because they cannot, you have to sit in one position for so many hours. Then it causes problems. It can cause DVT. And so to lower the risk, you should stand, stretch, walk a bit. When the seat belt sign isn't lit, should keep walking. Of course, many people don't walk in the plane except when going to toilet, but they recommend little bit of walking. At least you should move your leg up and down, up and down. You should give some exercise to your calf muscles. That is also helpful for diabetes, I tell you. So blood vessel problems include conditions such as clotting disorder. Clotting disorder means unwanted clotting happening. Then arteriosclerosis or atherosclerosis, that is called narrowing of the blood vessels. And then Raynaud's disease. We will show you the picture. What is Raynaud's disease? It means spasms of narrowing arteries in the fingers and toes. And then white or blue coloring in your fingers and toes. Okay, tingling, throbbing, or numbness in arms and legs. This especially if you have vitamin B12 deficiency and clotting disorder or blood vessel problem, then you are really a problem. And for that neurotherapy, we have got good solutions. Then clammy and cold skin. Then why am I always cold after working out? Working out means doing exercise. Working out can make you less likely to feel cold and heat. But normally when you work out, you should feel hotter. Okay. When you work out, your muscles produce more heat, which warms up the body and raises the temperature. But after working out, your sweat will dry out, causing your body temperature to drop. That's why I said sweat must dry normally, naturally, but it could fall so low that you start to feel cold. In rare cases, feeling cold after a workout may also be a sign of severe dehydration. This could happen if you have lost a lot of fluid from sweating and haven't drunk enough water to restore your levels. That means you did the exercise, but you did not take water. So normally, lukewarm water after an exercise is very good, beneficial. Okay, don't take fridge water or cold water too much, but lukewarm water is ideal. After a workout, you should take at least a glass of water because you have sweated so much. And especially when you walk in the sun and you sweat profusely, then you must have a glass of lukewarm water immediately after coming home. Okay. So now in diabetes, let us see, diabetes is another reason for cold temperature. So diabetes, if diabetes causes kidney damage, it's called diabetic nephropathy. And one symptom of diabetic nephropathy is feeling cold all the time. Help to keep your memory sharp. So in diabetes, the possibility of memory failure is always there. So whenever you have to help to keep your memory sharp by controlling 3 things. Number 1, you should control your blood pressure. Number 2, you should control your cholesterol. And number 3, you should control your blood sugar. And again, we saw this earlier. You might be more likely to develop hypothyroidism if you are a woman over 60 or have type 2 diabetes. So the symptoms are nausea and vomiting. We have got for this we say, normally we say CNNS gas, all 3 sides is the solution. Okay. Then itchiness, for this 1-point liver is the solution. Okay. Loss of appetite, also CNNS gas, all 3 sides. You see how many things is this thing. For shortness of breath, 15 medulla is good. Otherwise, angina treatment is a long treatment, which we have to show you. Then swelling in the face, feet or hands. So this is this thing. For this, we have got a treatment called 2-pan into 6 treatments. So we have solutions. I just want to tell you that neurotherapy, we have got solutions for almost every type of this thing, and they are all very specific solutions. They produce results immediately. Okay, just okay. Now, anorexia. This is another reason for feeling cold. Anorexia is a type of eating disorder. People with anorexia become dangerously thin because they have an extreme worry about gaining weight. And feeling cold is one of the symptoms of anorexia. And other symptoms are being 15% or more below typical body weight for your height. Every height has got a body weight. Okay, weight versus height, there is a chart available for ladies, for gents, different charts are available. So being 15% or more below means you are likely to have anorexia. And then such people are always thinking about their weight, and they have not having a periods, menses for 3 months or more. They are not having for 3 months, they don't have any menses. So that is also one of the reasons for low blood, for cold hands and feet. Then one more very simple reason is skipping meals. Some people get cold when they miss meals or consume too few calories. If this happens, the body naturally conserves energy and it produces less heat. Okay. So these are all, for all these things we have solutions. Then here we have low body mass index, BMI. Low body mass index means you have low body fat, and both fat and muscle mass help to keep the body warm, and muscle activity generates heat, and fat acts as insulation. Now this is a long topic. Now it is already 9:42, so I think we'll stop this here, and then we will ask if there are any specific small questions. We can take the questions. So please raise your hand. For about another 5-10 minutes, I will take some questions, and then, yeah, go ahead.
I request everyone to please switch on your videos when you raise your hands. Thank you.
Yeah, thank you. Okay. Okay, Ravindranath ji, go ahead.
Namaskar.
Namaskar.
Sir, it is a general question I am asking. So whenever you are doing any treatment, always you will do start with left, then you will right.
Yes.
Any reason is there? And second thing I want to ask, 1 point liver. Actually, liver is in right side, but why you are doing in left side?
Very good question. The first question, why we start with left, that is convention. That is our Gurudev has, Dr. Mehra has found out that this sequence is best for normal people. See, I will also tell you, this answer is related to your next question also. So I will answer the next question, then you will understand better. Now, in neurotherapy, what we are doing is we are diverting the flow of blood and lymph. They are actually diverting it. From where? From area of excess supply to area of deficit supply. So when I am applying, the liver is on the right side of the body. When I want to push blood into the right side, so naturally I have to stop blood elsewhere, no? That is why we are working on the left side. If I have to push blood to the top of the body, then I must press on my legs. If I have to push blood to the bottom of the body, that means below the navel, then I have to work on my arms. Okay, I have to work on the arms, and I have to keep my arms like this. I mean, all these things, theory will come in when you attend my classes regularly. I mean the advanced classes and all that. But still, for you, this is enough to understand that I am actually pushing the blood from area of excess supply to area of deficit supply. And for doing that, if I have to push the blood to the right, then I have to press on the left. If I have to push on the left, I have to press on the right. Okay. So now coming to your the first question, why you start on the left side of the body? I mean of the medulla. Now the medulla, you mean the body, we know that is called crossing of this thing. The left side of the body works on the right, and right side of the body works on the left. So in our system, normally, when you take the digestive system, the ascending colon, transverse colon, descending colon, and rectum. For normal bowel movement, this should be the way the stimulation should be made. The ascending colon, then only the descending colon, because that is the way the anatomy is designed. So when we press on the left side of anything of the body, then the reflection will be on the right side. The right side is the ascending colon, or the organs on the right, whatever. It need not be always to the ascending colon. It can be anywhere on the right. So first we work on the right side of the body, then we work on the left side of the body. That is for normal, let us say normal bowel movement. But in some cases, when you come to the advanced classes, you will know there is something you also know. You know already, ulta normal. There we are doing the other way. Why? Because there I want to put a lagam. I mean, put a restraint on the motility. I use ulta normal formula for loose motions. So there I want to restrain. There I am doing the other way. So I hope this answer is clear. Okay. Okay then. Now MS Rajeshwari madam, please.
Sir, good evening, sir. My namaskarams and very explanation about the all anemias and what are the causes for the disease and all that. Got a good explanation, sir. In the introduction, you told that cold feet, then you will tell that burning feet. First, you told that.
Pardon. Please repeat.
First, starting of the class, you told that you are going to teach the coldness of the feet, and you will cover the burning of feet. But burning of feet so far not covered, sir.
Which one? Warming.
Burning of feet, sir.
No. I have already said burning of feet is one of the most important symptoms of vitamin B12 deficiency.
That is only the
yeah, okay. Mainly that is the only reason. Reason is, and of course the other one I said also was that it is lack of circulation yes. To the feet. You know, sometimes what happens, the lumbar region, no, for the legs, the lumbar region, from there nerves come. Okay, somewhere in the lumbar region, a disc, that L4, L5 disc is always the problem. That may sometimes get slightly compressed. When that compressed, it pinches the nerve on that region. So then
prolapse, sir. So that the prolapse of the lumbar, stenosis, all that.
Yes. So that is one of the major reasons, and coupled with that, vitamin B12 deficiency.
What is the remedy for that, sir?
Vitamin B12 formula you have got. Yeah.
Okay, sir. That is. Yes. Thank you, sir. So
thank you.
Nice explanation, sir. Another thing I wanted to say, after the diabetic treatment along that I am doing, sir, I got reduced my sugar level, sir.
Great. Congrats.
Right, sir. So I wanted to thank you, sir.
Thank you.
Okay, thank you, sir. Thank you, sir.
Okay, welcome. Yes, Premlata Modani ji, please unmute.
Sir, namaste.
Namaste.
Sir, I am feeling cold in leg when I go into the AC. I have to carry socks with me.
Cold in legs is, yes, yes. Looking at your this thing, probably how much water are you drinking daily?
I drink water, but my weight is very less because diet is very less.
No, no, no. We will teach you everything. Start this CNNS gas, all three sides. Start it 3 times a day. Every meal you start. Okay.
Oh.
Have you started it already?
Sometimes I do this one on leg and the medulla too. Two I am doing.
No, no. Do it regularly. Don't say sometimes, because we are
Oh.
eating every day. No, you cannot say I am eating every day, but I won't do every day. That is not correct. And it hardly requires 1 minute. You
I
can
will.
see it is not a time consuming thing. So you should do it regularly. Then you will see the results.
Means,
Okay.
Vajranadi massage, medulla 8 and on
No,
liver.
not 8 medulla. For you, you will have to do 15 medulla, 10 medulla, 6 medulla.
15.
10, 6. 15, 10, 6. 6 medulla.
Okay.
All three you have to do, and then do the Vajranadi exercise.
Okay. Means 6 medulla is not sufficient for me.
No, 6 medulla, these three together, see, 6 medulla is also working for the hypothalamus. It will help you to heat up the body. But for heating up the body, I have already said one treatment, 6 medulla and 4 thyroid. So if you do that, then it will heat up the body to a certain extent. Okay. And then 1 point liver also will heat up the body. Okay. So all these things will happen. And
The
since
15,
you
first
1 minute.
15, then 10, and then 6. It is
Yeah,
like
yeah,
this.
yeah, yeah. Give about 15 seconds gap in between. 15, 10, 6. You give 15 seconds gap and then go ahead. Okay. Fine. Now we'll take only one more question because its time is up. I will continue this next week. Ramanashri madam, please, Ramashri madam, please go ahead. No, you are muted, madam.
Good evening, sir.
Yes, good evening, madam.
Sir, my husband met with accident 1 month back, 2 months back, and he is feeling chillness every day in the evening timings.
I said this, that I think I have the liver treatment will help you. Definitely liver treatment and thyroid treatment. 6 medulla, liver and thyroid. These 3 treatments will help him. Okay. Medulla, you know already. I have shown just now 8 medulla.
Yes.
Like that, you do 6 medulla. Okay. Then you do 1 point liver.
Okay,
and do
sir.
it several times a day.
Mhm.
Every 1 hour you can do liver. Liver is very, very essential for, especially for whenever you have an injury, accident, the operation, for all that liver is very useful. Then I will also just hold on the line. I will immediately send one liver treatment. Is 60-toe finger gall liver. If I can locate it immediately, or I will send it later today. I will say write it down here, and I will send it. 60-toe finger gall liver that you can ask him to do. 60TFGL3. Send. Okay, I have written it down. I will send you the video. You look at the video and do it. Do it for him. He can do it himself also. If he is mobile, he can do it himself. And you will see his coldness will reduce somewhat. But more than that, I have to take a full this thing. If you have any time, if you have the inclination, you can come for a consultation. Then I can study this thing, and I can suggest you on Zoom itself. I can suggest you what are the other additional formulas you require to give for him.
He was staying in AP, sir.
AP, no problem. If your Zoom is available, it is enough. I am in everybody's bedroom. Zoom.
Okay, sir.
Yeah. So you don't have to come to meet me. I don't invite anybody to come and meet me. I say Zoom is very good and we can do that. Okay. So thank you very much. I thank everybody. Now I take this opportunity to thank Joshys Kerala Group and Anusha Madam and everybody. And Madam, please, you can wind up. Thank you very much. Thank you. Or I will give the blessings and then you can wind up.
Yes, please.
Okay. I thank Joshys Kerala Group, Anusha Madam, and each and every member of this esteemed group, Joshys Kerala Group, for attending my lectures sincerely, for asking the questions, and for having interest, sustained interest in neurotherapy. May God bless each and every one of your family members with health, happiness, harmony, peace, prosperity, and success. So, thank you, and God bless us all. Jai Hind, Jai Bharat, and Jai Neurotherapy. Thank you. Yes, madam.
Gratitude for this session, sir. As always, you try to cover everything and also give extra for all the members. So we share our gratitude from all of us, our hearts to you, filled with gratitude. So now I open up the mute buttons for all of you so that you can unmute and share your vote of thanks only. And thank you so much. Tomorrow again we have 7:30 p.m. class. So please share your vote of thanks.
Thank you, sir.
Thank you, sir.
Thank you, sir. Thank you, sir.
Thank you, sir. Thank you
Thank
very much.
you very much.
Namaskaram.
Thank you, sir. God bless you. Good night.
Thank you, sir.
Next
Thank you,
neurotherapy
sir.
session is on
Thank
Friday.
you so much.
And tomorrow we have
Thank you so much, sir.
Thank you.
Thank you.
happy
Thank
weekend
you,
to all.
sir.
Good night.
you.
Thank you,
Thank you,
sir.
sir. Thank you so much.
Thank you.